name is Moses Tabe Ambilichu. I'm a doctor of medicine and surgery specialist in neuropsychiatry. I'm the chief medical officer here at Success Health System Worldwide Psychiatry Services. We have decided to create a series of educational videos to explain and enlighten people around the world about mental illness. We will call this series the ABCs of mental illness. Before I get into the nitty-gritty of the psychopathology, I want to make a disclaimer that these videos are intended for educational purposes only, and they're not designed to treat or cure any particular condition. If you think you're suffering from any specific psychopathology, I would encourage you to seek consultation with a qualified provider in your area, or with us if we have medical jurisdiction where you live. All right, so the first illness we'll talk about is major depressive disorder. Why is it important? Because it's very common all around the world and it's extremely disabling. The World Health Organization places major depressive disorder second to cardiovascular disease in terms of disability. The good news is major depressive disorder can be treated and can be treated satisfactorily with the somatic solutions I will explain here in a little bit. Now, how does the patient present to the physician with major depressive disorder? Well, they may have depressed mood, loss of interest in pleasurable activities, they may have low energy levels, concentrations may be impacted, appetite could be up or down, sleep may be up or down. Sometimes patient may be slowed in their speaking and movement, and they may have ideation of self-harm or even completed suicide. That's why it's extremely important. We explain this so that we try to demystify, to reduce the stigma around mental illness. 40% of bad outcomes in psychiatry is due to stigma here in the United States of America, but across the world it could be higher, reaching 80–90% in parts of sub-Saharan Africa. Now, with this presentation, the clinical physician or advanced provider will execute what we call a mental status and or physical examination, and then they will come up with a diagnosis. After the diagnosis is established, the physician may require additional testing or laboratory studies, as the case may be, and then we will proceed with the treatment plan. The treatment plan may involve medications and or clinical psychotherapy. Medications include things like fluoxetine or paroxetine or sertraline or medications of those class. There are other higher classes of medications such as bupropion or mirtazapine and so on. There are somatic treatments that can be used for major depressive disorder which are FDA approved, such as transcranial magnetic stimulations or esketamine, otherwise called Spravato. Now, the physician will, depending on your particular clinical terrain, advise on what specific therapies to adopt. If you are interested in making an appointment with us, so we are able to see new patients 80% of the time within 24 hours. Most of the time, a lot of the patients can be seen within 1 week. And to make an appointment, call us. The number is 888-410-5230, or visit our website www.successhealthsystem.com. We have active clinics in Kansas, in Missouri, in Olathe, Independence, Columbia, and in Crevco, Missouri. All of that detailed information is found on the website. Please, if you understand the discussion that we've presented, please share with your friends, like our page, teach other people. Together we can fight stigma and bring mental health under control in the United States and worldwide, and especially bend the curve of suicide. Thank you for listening. This is Dr. Ambilichu from Success Health System Worldwide Psychiatry Service.